And good morning. Welcome to Health and Social Services of December 5th. And I'm going to do the roll of the call. Call of the roll, sorry. And thank you for doing that. Is there any declarations of pecuniary interest in any items on today's agenda? Moving on to the adoption of the minutes, can I have a mover from the November 7th minutes? Councillor Dye, second by Councillor Anderson. Any questions? Hearing none. Any opposed? We have no statutory public meetings, and I'm going to move to the presentations. We have Dr. Pepe McTavish, the Associate Medical Officer of Health, and Dr. Hedal Patel, the Public Health and Preventative Medicine Resident. And thank you very much.
Thanks so much for having us. Everyone can hear me okay? Yes. So thank you very much for having us this morning, members of committee. The last time the health department was here to present on the same topic was January of 2024. So thanks for the opportunity to come back and give a little update about what's been happening. I'm very happy to have Dr. Patel with me today. So she's been a senior public health resident with Dr. Kyle and I for the last 6 months. She'll be done next week. It's been an absolute pleasure having her. So happy to have her co-present with me today. Okay, so this is new, but it's not new because I did present this new RESP tracker to you in January of last year. So if you remember from COVID, we had the COVID tracker, and before that, and during COVID as well, we had our flu tracker. So what we've done now is we've combined them. So we have one respiratory tracker. You can see it here at durham.ca/RESP tracker. Lots of great information still. We have less information than we did have during COVID, but still great information on this tracker that our community members still report to us that they use and find very useful. So this is the landing page where we see COVID and influenza, and this is a snapshot about what's happening this week compared to last week. So here for COVID, you can see the positive tests are stable. That's a very good sign. Our outbreaks are stable, and hospitalizations are increasing just a little bit. And then with flu, it's hard to say because it's 1 and 0, but 1 is stable. And then the 0 outbreaks are also stable. But we know, and we'll get into it, that flu season comes a little bit later from now. So it's a great resource. This is a snapshot in time compared to last week, just to see where we are in the region. So moving on to COVID. So here we're going to talk about our lab tests and percent positivity. So it's very small along the bottom, but you can still sort of see it's August to August for the testing weeks. That's how we report out on respiratory illnesses. It's not a January to December reporting. So from here, you can see this is the end of August or middle of August to now. So if you look at the left axis, the number of tests, that's what those blue bar graphs are. We've had a lot of tests happening in the region since August, and even from before. You can imagine that didn't go from 0 up to 500 in August. And it's hard to access the test, as you know. So my mom had COVID a few weeks ago. She's well, but she took a home test. It was expired, but she had those left over from last year. That doesn't get counted, right? What gets counted here is people who are in hospital, in long-term care, and in retirement homes. So that's what the blue tests are. So there's been roughly 400 to 500 tests done per week in Durham for people who can access them. And then now we're going to look at that blue, the dark blue line, and that lines up with the percent positivity on the right-hand side. So this is the number of tests out of 100 that would be positive. So in the last week, almost 16%, so 16 out of 100 tests would be positive. So out of the 400, there'd be roughly 60. So that's a lot. That's a lot of people who are testing, who are symptomatic, getting a test, and then testing positive. And this just tells us there's a lot of COVID in the community. The burden is high. And everybody knows that. Everybody right now, I'm sure, knows somebody who is sick, if they haven't been sick recently themselves. So talking about burden moves nicely into hospitalization. So here again on the bottom is August to August. So this is from August until now. That's what these blue lines are. And basically you can see that there's been a lot of hospital admissions across Durham since August and even before. It's not really letting up. Is this going to increase? Yes, likely. After the holiday season, everybody sort of congregates together and respiratory illnesses go up a little bit. But since August in Durham, we've already had 176 hospital admissions. This isn't people who go to emerge feeling unwell and then get sent home. These are people who are admitted. And unfortunately, there's been 6 deaths in Durham since August. And this is still the beginning of the season. So we're not quite out of the woods with COVID yet. Okay, and I'm going to pass it over to Hedal for wastewater. Thanks.
All right, so we'll shift gears a little bit to wastewater surveillance. We've been very fortunate to have local wastewater surveillance data available in Durham Region. Unfortunately, that data is no longer available, and that's because of the provincial wind down of the wastewater surveillance initiative. Um, that being said, there are still 4 wastewater surveillance sites that are available in Ontario. However, all 4 of those are in Toronto. As you can see from the image here, all 4 sites are showing moderate COVID-19 activity levels. So this is pretty much in line with the higher test positivity that we're seeing of COVID-19 that Pepe just mentioned. So back to the respiratory tracker to look at influenza. So from here we can see that we are already seeing influenza in our community. To date, we've had 28 confirmed influenza cases in Durham Region, but it is important to note that that is likely an underestimate of the total number of cases that we see because not everyone has access to an influenza test. So influenza testing is available to patients that are hospitalized. It's available in some emergency departments and in some family doctors' offices. So likely the number is quite a bit higher than 28. So this graph shows us the influenza cases over the past few respiratory seasons, so both during the pandemic and since the pandemic. And this year's influenza cases is pretty much in line with what we saw in the last respiratory season. So that dark pink line shows us the influenza cases for the 2023-2024 respiratory season. So it looks pretty similar at this point, but it is still quite early. One other thing we can see here is that during the years of the pandemic, so 2019, 2020 to 2021, there were very few cases of influenza, little to no cases, and this is likely because of the public health measures that were in place. So those public health measures helped to reduce the transmission of COVID-19 and at the same time helped to reduce transmission of influenza as well. One additional thing to note is that we haven't yet gone back to a similar pattern of influenza that we had prior to the pandemic. So before the pandemic, we used to have 2 peaks of influenza. There was an initial peak of influenza A from November to January, and a second peak of influenza B from about January to February. And we haven't yet seen that, but it is possible that could be coming this year.
Thanks, Hetal. Back to me for respiratory outbreaks. So these are our confirmed institutional outbreaks, and if you recall, institutions are hospitals, our local long-term cares, and retirement homes. And again, this is the timeline from August to August on the bottom, so August till now is those bar graphs. So already there's been 78 confirmed outbreaks in institutions, so that's a lot. That is a lot of work being done by our homes and our hospitals. And this is online. This is very similar to last year, what we've seen. So will we see a peak soon? Likely, yes. So if out of 78 total outbreaks, you'll notice that 58 of these are COVID. That is a lot of COVID outbreaks. Only 1 of influenza, 2 of RSV, and 3 of other, which can be rhinovirus, human metapneumovirus, just sort of the other viruses that we see in the institutions. So if you can imagine with me for a second, if there was no COVID on this graph, what would it look like? And would we be here presenting to you even today about the respiratory season? So just to note that this has been a lot of work over the past few years for the homes, especially the long-term care homes. It's not great when homes are in outbreak. Staff do the best they can, but people can't move around like they normally do. Maybe if they have lunch with a certain friend on the other side of the home, they can no longer do that because their groups get cohorted. So it's not great when homes are in outbreak, and everybody does their best to make sure they're not in outbreak. And it would be nice if we saw even less COVID-19 next year to have less homes in outbreak. So just a reminder, we had this dashboard pre-COVID. This is durham.ca/outbreak report. It's an excellent resource. During COVID, it was sort of moved into the data tracker. And if you remember, we used to list the homes and the staff and the residents every day who were positive. So we don't do that anymore, but we still have to report out on outbreaks in our institutions. So hospitals, long-term care, retirement homes, if you go to this website, you can see who they are and how long they've been in outbreak and what the agent of outbreak is. In COVID testing, we've had a lot of questions about this actually. So in September, the province changed gears and decided to do a test to treat approach. And that's basically if you are somebody in the community or in hospital or long-term care who would have access to treatment or it would change your management, then you have access to a test. So for example, in high-risk settings, so long-term care and hospitals, people need ongoing access to tests. They need that for patient management. They need that for home outbreak management as well. So they will always have access to tests, absolutely, especially, and same in the hospital. But with community, it's only people who are eligible for the treatment are able to get the testing. So these are people who are symptomatic, who are otherwise unwell, immunocompromised, those who are 65 years or older, or of high-risk medical conditions. So for example, I don't fit in any of those categories. If I was unwell, I would not have access to Paxlovid, so I would not have access to a test in the community. I could use my own expired test at home to see, but it wouldn't be counted. And then testing can be accessed right now through some primary care providers and mostly through pharmacies. And I do understand there is a cost at some pharmacies for that testing. And back to Adel.
Okay, so moving on to vaccination. So as of October 28th, both influenza and COVID vaccines have been available to the general public. So it's available to everyone aged 6 months of age and older. Our priority populations were offered vaccination earlier in the season. So this includes adults aged 65 and older. It includes healthcare workers, and it includes residents and staff of long-term care homes, retirement homes, and congregate living settings. At this point, both of these vaccines are available at select pharmacies and some primary care provider offices. The health department does have appointments available. This is for children that are 6 months to 4 years of age that are having difficulty accessing the vaccines. And we do have the primary care outreach program, which continues to offer vaccines to people who are homeless or underhoused. In terms of the RSV vaccine, there are two main programs from the ministry this year. So there's the higher risk older adult program, which offers the Abrysvo vaccine. This is for adults that are age 60 years and older who are also residents of long-term care homes, retirement homes, or elder care lodges. It also includes some of the higher risk populations with medical conditions, so those that are receiving dialysis or transplant patients, for example. Now, those that are age 60 years and older that still choose to have a vaccine can still access it, but they would have to purchase it at a pharmacy. The second program is the Infant and High-Risk Children Program, which provides the immunization called Beyfortus. So this is a vaccination that's available for all newborns that are born during the RSV season, so approximately November to April. It includes all infants born in 2024, and it includes all high-risk children, so children with medical conditions that are under the age of 2. And in addition to this, there is also a vaccine that's available for pregnant patients. That one is Abrysvo. It's for pregnant patients that are between 32 to 36 weeks gestational age, and that would be for protection of the newborn.
And that's it. We're very happy to answer any questions.
Great, thank you very much. I have Mayor Foster.
Thank you, Madam Chair. Dr. McTavish, did I hear that Dr. Patel is leaving us imminently?
She is. She'll be done her residency shortly.
So Dr. Patel, for all that you have done, thank you ever so much, and I'm sure that is shared across the entire committee. And I'm not sure who would answer this, but in a how to put the question, you'd mentioned, I think it was you, Dr. McTavish, that was saying without COVID, you may not be bothering to make this presentation. I think we've all gotten used to COVID being amongst us, but is there a better way that we can articulate that COVID is amongst us? We need to take precautions. I think we've all gotten sort of taken for granted that it's in amongst us, and yet people are still dying. So how are we communicating simple things like, please continue to wash your hands, cover your mouth when you cough, don't share your coffee. I'm being a little bit flippant in my suggestions, but you know where I'm going.
Mm-hmm. So through the chair, that's a great question. And I think actually everyone's doing a great job. And the reason we're not seeing it higher is because people are still taking it seriously, right? Like people are still getting vaccinated. I don't know about you, but everywhere I go, people are still masking, especially in doctor's offices, dental offices. I had an eye exam last week. I had to wear a mask. Certainly, you're in close contact. So I think people are doing a great job. I think people are taking it seriously still. I do believe that, besides a few. In general, the community is doing a great job. They're getting vaccinated. They're staying out of high-risk places. People know now when they are sick to stay home. We see that with our coworkers. People used to work all the time. Oh, I'm fine, I can keep working. And now they stay home, right? It's greater they work from home. So I think we are doing a great job. Could we do more? Yes, but already I think the reason we're only seeing the rates that we are is because of the work that we're doing.
Okay, so I'll leave open if the lower tier communications departments can be replicating messages coming from Durham Region. If we're not doing so already, let us just, a very quick story. Many of regional council went to FCM in Calgary. 10 from Clarington out there, 7 of us came back with COVID from FCM. It was an incredibly mild version of COVID. So had one of my colleagues not tested positive, I wouldn't have bothered to test. I would rather have had that version, which is not to diminish COVID. It's to diminish our awareness. So, my reaction was obviously not nearly as bad as perhaps someone in a nursing home. So that a bit of a lesson learned, but I wouldn't have cared the less. And to your point, getting those home tests, I got the last box from a drugstore. Madam Chair, thank you. Dr. McTavish, thank you. Dr. Patel, thank you.
Great, thank you very much. Any further questions? Not hearing any. Thank you very much for the presentation, and hopefully we don't have the COVID presentation in 2025.
Agreed. Thank you.
Thank you. We have no delegations, and we're going to move to reports with 7.2. Can I have a mover on the report? Chair Henry, seconded. Councillor Anderson. Any questions? Any opposed? So we have nothing under Social Services Advisory Committee resolutions. Is there any other business? Mayor Foster.
Thank you, Madam Chair. A couple of things. I just sent a letter from that was sent to the mayors that signed the letter, the infamous notwithstanding clause letter. There, of course, was a far more information in that. My phone is a bit of a pain, but I will share that. Apparently, we've got some programs and additional funding coming dealing with addictions, drug use, and the homeless. So we'll be looking forward to that. But I will share that with Stella as well. I am curious as to where we are with the homeless strategy, the encampment strategy that is that's coming from Durham.
So I have Lisa present here. Stella is at a conference at this present time. So Lisa, if you wouldn't mind speaking to it. Oh, just over to your far right.
Thank you.
There you go.
So the encampment strategy is moving forward. We finished the first round and second round of engagement. The document is almost prepared and accessible to be able to share for another round of review with the local area municipal staff and those that were involved in the first round of process. So that would include mayors and local teams, as well as bylaw, fire, health, legal. So it'll do that second review now that it is a wholesome document and ready to be looked at.
So that is imminent?
The sort of this round of the review is imminent, and then the plan is to have a clean, fully edited document that there is a level of consensus on to present by February.
Okay, great. Lisa, thank you ever so much. And Madam Chair, a quick comment. Members may or may not be aware that Bethesda House Women's Shelter in Bowmanville had planned on presenting to committee. They and all of the shelters are in desperate need of funding, and we've seen the statistics on the number of women and children that are turned away. I want to thank staff. The reason Bethesda House is not in front of committee this morning is staff are working with Bethesda House, and I assume the other women's shelters and other shelters to come to some sort of resolution for the challenges that they're facing. So that's staff getting ahead of a problem, being proactive, and for that I am truly thankful. Thank you.
Thank you for recognizing their work as well too, Mayor Foster. Is there any other business? I do have one question, and that is to Dr. Kyle. And I've just pulled it up with the Auditor General's report and how far behind Ontario is with the opioid crisis. And I was kind of expecting Mayor Carter to be asking this question, but if there's any feedback that you have just with what the Auditor General presented about Ontario's program with dealing with the opioid crisis.
Chair, thanks for the question. I have read the at-a-glance part, and I've read the recommendations. I think it's a very damning review. I think it speaks for itself. Sadly, there weren't too many surprises, unfortunately.
Yeah, I appreciate your feedback on that. Okay, any other questions under new business, other business? Seeing none, next meeting is January 9th, and we will be dealing with budget next Thursday and Friday. And looking for a motion for adjournment. Councillor Dyes, Councillor Anderson. Any opposed? Thank you.